So Elaine Book is a social worker at the Movement Disorder Clinic. Ms. Wang is a dietitian at the BC Brain Wellness Program. And Mr. Fari is an OT for almost 20 years working in the movement. And now I would like to pass it over to our presenters.
Thanks, Kelly. I'm just going to share my screen. And I just want to make sure everybody can see that. Somebody tell me you can see that. Oh, thank you, Yolanda. Okay. So, hi, everyone. As Kelly said, I'm the social worker in the Movement Disorders Clinic. I've been there for almost 18 years, and I think I've learned from people as much as I hope that I've been able to teach them. And it's great to see so many of you here today and just being proactive about your diagnosis and your health. So I'm going to tell you a little bit about the social work role and how you might access it or use it. Oops, there we go. So the role of social work in Parkinson's disease care is kind of summated right there. It's to provide information, counseling, and referral service to help people and their families understand, adjust, and manage the emotional, social, and practical concerns that might arise as a result of Parkinson's disease. So that's quite a lot there. So I'm just going to unpack it a little bit. So in terms of emotional support, and emotional and social support, that can be around the impact of the illness, the motor impact, the non-motor impact on the person with Parkinson's, their family, and their lifestyle. It can be about loss of independence and grief. It can be around decision making about work, living arrangements, future planning. It can be around communication issues, impulse control issues, anxiety, depression, stress, and certainly caregiver support falls under that. In terms of referrals and resource navigation, that might be around financial things like pensions and disability benefits, home support services, housing, assisted living, legal stuff like powers of attorney, representation agreements, and then other kind of general resources like Handy Dart, Meals on Wheels, Lifeline, all those kinds of things. And under education, really, I believe that PD education knowledge is really king. And it's important to know a little bit about your disease. It doesn't mean you need to do a deep dive and get emails blasted to your inbox every day about Parkinson's disease, but some level of understanding so that you know when you get a symptom, is this Parkinson's or is this something that I should be going to my family doctor about? So there's lots of useful websites and webinars and books, and I also do a lot of education around coping as well. So this is just a bit of an overview of the roles so that in time or over time, you have an understanding going forward what I focus on and what you might tap into my help for. Oh, it keeps jumping one. Gosh, there we go. So for today, I'm going to talk a little bit about disclosure, dealing with anxiety and depression, addressing loss and grief, the importance of communication, self-management, care partners, and end with something that's pretty important as you navigate health conditions. So that's just a little bit about what I'm going to talk about. Well, for some reason, this just keeps bopping around. Okay, so first off, around disclosure. So the decision to discuss or disclose the diagnosis is really an individual choice. And some people don't want others to know about it. They don't want to be labeled by their illness for fear that they might be viewed differently by family, friends, employers, colleagues, that kind of thing. But I guess I just ask you to bear in mind that those who are near and dear to you probably are already aware that there have been some changes in you. And it actually might be valuable to let them know that there are changes in mood, that those changes in mood and behavior, physical activity, work performance, those are all changes for a very legitimate reason. Otherwise, people kind of tend to make incorrect assumptions about you without knowing what's really going on. And sometimes it's good to just share what some of your concerns are with somebody else and then receive some support as well. So what about Whoa, I don't know where my slide is there. That's kind of funny. It's not coming up. All right, well, we're just going to talk what about work. Um, so Parkinson's disease can certainly affect your work depending on the severity of your symptoms, the progression of your illness, the type of work that you do, and the symptoms that you have, because not everybody has the same symptoms. So some people continue to work and they're mindful of the changes that might need to be made in their duties or their hours, and others make the decision not to work because their jobs are too physically demanding or too stressful. Certainly, finances are a significant consideration here, but there's also this emotional piece that is attached to work and what work means to you. Work does provide a sense of satisfaction and accomplishment, and keeping joy in your life is important as well. So some people say, well, when do I tell my employer? Again, um, it's a very personal decision. Something for you to take into consideration is certainly your stage of illness and the management of your symptoms, your job, your status in the workplace, in terms of seniority, the nature of your relationship at work. And certainly some people get concerned about being reassigned to a different job or perhaps encouraged to retire. But most would agree that sooner that you tell your employer or your support network is generally better in the long run. Right. Hopefully not all my slides. All right, there. Now we're back on track. So some tips for disclosure, and certainly in the interest of time, I'm not going to read this whole slide to you. You have it, you'll have the content, but these are just some general tips that you might use for disclosing the diagnosis in any situation. Okay, on to anxiety. So you've probably learned a little bit about how anxiety is part of the condition. And really, there's a two-pronged approach. There's medications, and then there's strategies. Often people don't want to take more medications because you're already taking medications. But in order to use some non-medicinal strategies, sometimes we have to get into a place where we can use those strategies. So if the strategy is a mindfulness practice, but the anxiety prevents you from participating in that practice, then it might be helpful to take a little something that's going to allow the mindfulness practice to happen. And I kind of sometimes say to people who are reluctant to take things for anxiety or depression, when I say you can feel better, these are parts of the condition, the symptoms that can be improved. And the other thing I say is that, if you had diabetes and I said you needed to take insulin, you would probably not fight that. You'd probably take it. And so anxiety and depression are no different than that. CBT, that's cognitive behavioral therapy, can be very helpful in conjunction with meds. And simply put, CBT is about how our thoughts, it's kind of a triangle. Our thoughts affect how we feel, which affect how we behave. And so it's a restructuring of the way we think of things that then changes how we feel and how we behave. Lots of counselors out there who do this kind of work. And lots of resources available as well. I've listed some of them there. And I have a longer list of resources at the end as well. So Wendy Suzuki is this author who wrote this book called Good Anxiety. And she basically says, we can't get rid of anxiety, but we can learn how to worry well. And these are kind of 3 steps that she talks about. So turn down the volume on our anxiety with meditation, with breath work, with working on your mindset, with exercise. Those are ways to turn down the volume on anxiety. She also talks about explore those uncomfortable emotions. What is your worry telling you about what's important to you or what's going on with you? So just spend some time looking at that. And then she says, enjoy the superpowers of anxiety. So channel that energy into action and turn the what if into a to-do list. So it's really about anxiety into action. So these are just a few kind of proactive strategies, things that you can do in advance to manage anxiety. But what about that sudden onset of non-motor symptoms? Like you're going about your day, you're at the bank or the grocery store, there's a long lineup, It's taking longer than you thought. You can feel your meds are wearing off and you're starting to get anxious. So there are quite a lot of simple strategies that you can do to manage anxiety in the moment, things that can be done anywhere at any time. And I have those listed at the end. Goodness, there we go. Okay, so here are some signs of depression, and I list them here because, again, sometimes people aren't aware of these signs of depression and they might think it's something else. Cognitive decline is often what people are worried about, but certainly these are very common signs of depression. And similar to anxiety, using a combination of medication and coping strategies can be quite effective. And I just want to reiterate, I don't get a pushback from a kickback, I should say, from the pharma companies in terms of prescribing medications, but I just really have seen so many people who have started with a low dose, and it's really impactful on their quality of life. And I am mindful that there's a stigma attached to feeling anxious or depressed. And I recognize that, and you may as well. But really, the sooner that you do address these symptoms, the sooner you will feel better. So, related to that is these ideas of loss and grief. So, going from being a well individual to somebody who is a chronic progressive condition is a major and ongoing transition with feelings of very different feelings and emotions like anger and fear and anxiety and sadness and loss and grief. And all of these feelings are very valid and very normal. And they're also different for people and they shift over time as well. So, how you manage these feelings really does impact how well you manage the Parkinson's disease. And loss and grief are not often talked about in the context of a health condition. And so I just want to take a moment to give them some attention because when you name a feeling or an emotion, it can be quite an enlightening experience. And I've had many people who said to me, oh gosh, I never really thought of how I was feeling in this way, but now that I do, that's going to help decide how I'm going to try and manage it and how I'm going to deal with it. And grief is not necessarily bad. In fact, it's a healthy process. It leads us to acceptance and adjustment, and it's how we get over things and it's how we move on. So I encourage you to take some time to think about any losses that you've experienced related to the Parkinson's disease and how you've addressed them. And having an awareness and insight into how and why you are feeling something might bring along the ability to respond rather than to react. Well, my PowerPoint is being a bit challenging. Okay, excuse me. So, Parkinson's disease is a family affair. I often say to people with Parkinson's, you are the person with the disease or you are our patient, but it's actually not all about you. And to the caregiver, you are an important part of this and your needs need to be addressed as well. So, receiving support that you need as a caregiver will allow you the energy that is needed to be part of a caring relationship. Now, at this stage, you caregivers or spouses or siblings or adult children may not necessarily be doing a lot of hands-on care. And so as a result, the effects in this care partner role might be more subtle and when with more kind of general concerns, about the future or role changes, the unknown, that kind of thing. But the reaction to the diagnosis can be very similar for the person with Parkinson's as it is for the care partner. Again, shock, anxiety, worry for the future. The impact of the diagnosis can really add strain to any relationship, and so communication is critical. And throughout the illness, it is critical throughout the illness. And I'm going to talk a little bit more about that in a moment. Just going to take a drink, excuse me. Just got saddled with a bit of a cold yesterday, so I'm a little bit raspy. So there's lots of material out there for care partners. I certainly encourage people to look at some of that material in advance of feeling burnt out or challenged by their role as a care partner. That again, that proactive kind of building your toolbox up before you need any of the tools. Really the strength and resilience that I've seen of people in these roles really is quite amazing and inspiring. But it is a balancing act and often one of compromises, kind of looking at what's best for the person with Parkinson's, but also taking into consideration the needs of the caregiver. Okay, so I said I was going to talk a little bit more about communication, and I do talk to people in the new diagnosed stage about communication. We have to remember that this diagnosis is on a bed of established communication and relationship patterns, both good and bad. Um, and I fully recognize that the challenges of being honest about sensitive feelings of fear for the future might not be the kind of relationship that you had in the past. It might be new territory. But often these things are not huge and not insurmountable and can often be helped and nipped in the bud with the support of a counselor or self-help activities or even some of the resources that I've listed in the end, at the end. Excuse me. So I just want to talk a little bit about self-management, the concept of self-management, because now is really the time to embrace this concept. And it's about taking responsibility for managing aspects of your health and well-being. That's kind of the simplest way to look at it. And here is a list of things that you can do that are self-management types of activities that can help you manage your condition. And then the other side, there is a list of that was created by Dr. Sonia Mathior, who is a young onset person with Parkinson's and has become a phenomenal advocate. And this was her list of things that she wished she knew when she was diagnosed. She talks about how she spent the first 6 months kind of rolled up in a ball under a blanket. And she says, if I could have been able to look at things through this lens, I think I would have been better off. So um, the other thing that I'd say about self-management, it's about gaining a sense of control when you feel that things are out of control. And sometimes one way to do that is with planning for the future. So things like powers of attorney, representation agreements, wills, these are really things that are necessary for all of us, regardless of whether we have a health condition. But sometimes it's something that can really help um, people who are feeling like things are not within their control. So, whenever I talk about coping, I always seem to talk about hope as well. Now, interestingly, they are connected by rhyme, but I do believe that they are also connected because one who is able to maintain hope does cope well. So, hope is not about endless positivity and optimism. Dr. Jerome Gropeman, who wrote a book called The Anatomy of Hope, says hope gives us the courage to confront our circumstances and the capacity to surmount them. Similarly, Viktor Frankl, who wrote the book I think it was called Meaning of Life. Um, well, he spoke about the meaning of life, and he basically says if you have a why, then you can cope with any how. So hope is a hard concept to kind of wrap your head around sometimes. Again, there's lots of material out there to help make that cognitive shift for people, but it's valuable. The other thing I was going to talk about is just this practice of joy. Um, I really want to stress the importance of incorporating the joy as a practice in your life. That if you are able to excuse me, create and identify joy and have that become a well ingrained practice in your life, it really does help manage when the crises of life inevitably happen. And so the author of this book, The Light Maker's Manifesto, she says that you should ask yourself these three questions every day. How can I feel connected today? How can I feel healthy today? And how can I feel purposeful today? And again, in trying times, often joy is the first activity that we tend to let go of, but it's really a valuable one to be intentional about on the daily. So I'm just going to try to get to my next screen. Goodness. Well, where to find counseling support? Um, the Movement Disorders Clinic, if you're part of our clinic or any of the other clinics throughout the province, Parkinson Society BC, counselingbc.com. There's also the BC Association of Social Workers and lots of other private agencies. And I do have this as a list, and you'll have it in your in your um, in your package. Oh, there we go. It's just being a bit finicky here. And then I just have some resources here, good things to click on. And again, you're going to have all of this. And at the end is my coping strategies cheat sheet as well. So with that, I'm going to pass the baton over to Yolanda.
Thank you, Elaine. Thank you for sharing all this information. It's always helpful to know what other health professionals are doing with our clients, and so we can provide more collaborative care. I'm going to share my slide as well for this section. So I'm a registered dietitian. I'm also a personal trainer as well. But today's focus will be more on the nutrition side, of course. So my section will do a quick nutrition screening self-check, and then we're going to talk about what symptoms or concern can dietitians help, food choices and healthy eating guidelines, and a bit of gut health. First, if you do have a pen and piece of paper next to you, please take that, and we're gonna do a little bit, we'll go through 8 questions, and we'll see how are we sitting on the kind of nutrition risk level. Again, like this is not specific medical advice for you, but it's usually a good kind of nice to know information. If the results do show you have a bit higher risk for malnutrition, then it's important that you consult your health team about that. And this is also tailored to people who is 65 years old and older. But the information in this screener, I think, is pretty informative on like what are the consideration would you think about if you need a dietitian's help or not. So hopefully that's enough time for you to grab something to record the answers. So each question have a number in front of each answer. So if you know which answer described you the most, then just record that number and we'll add those up at the end. So first question, has your weight changed in the past 6 months? Also feel free not to go through it if you don't feel comfortable. It's not complete. It's not necessary if you don't feel comfortable. All right, so I'll leave maybe 5 more seconds. All right, second question, do you skip meals? Okay, this is a short one. Third question, how would you describe your appetite? Okay. Fourth question, do you cough, choke, or have pain when swallowing food or fluids? Right. Fifth question, how many pieces or servings of vegetables and fruit do you eat in a day? Vegetables and fruit can be canned, fresh, or frozen. Sixth question, how much fluid do you drink in a day? Example can be water, tea, coffee, herbal drinks, juice, soft drinks, but not alcohol. And 7th question, do you eat 1 or more meals a day with someone? Right. Last question, which statement best describes meal preparation for you? So it's a bit longer, so I just leave maybe 5 more seconds. All right. So that's all the question, and you can add the answers to the questions together and see what's the total score. And again, this is just a quick screening. If you do find you have higher risk, and if you have like specific reasons for that, it doesn't always mean that you are more nourished, but it's important to go over that with professionals like dietitian, especially. And there are some resources on the website where this screener is developed. So I will share that link at the end as well. All right. Okay, so hopefully that provides you a little bit kind of insight on like how's your nutrition status is. And now we're gonna go in a little bit more on the Parkinson symptoms and how food and nutrition interact with Parkinson's disease. So this is a complicated graph. I can guide you through it. So on the right side here are a few different dietary patterns that are being researched on its impact on Parkinson development or progression. That part is not so clear what food or diet could help with preventing it or slow down the progression. But there's definitely some patterns that shown some potential benefits. We will go into that a little bit later. And then in the middle here are potential pathology of how kind of pathophysiology of how Parkinson's disease are developed. This is again like just a theory. We don't know how it's exactly developed, but there are some theory that it starts from the gut dysbiosis or is related with gut dysbiosis, and which cause increased inflammation around our gut and increased permeability, and which further lead to a systematic inflammation, which cause the inflammatory factors to cross blood-brain barrier and either cause or further degrade the neural integration of our brain and the central nervous system. So again, this is just a theory. It's not necessarily how it actually happened in our body. But on the left side is what we kind of know more of. So what are the common symptoms and how that could impact our nutrition status? And this is where the dietitian can come in to help you. So some of the symptoms listed here could reduce or alter your energy or nutrition intake. And some of the symptoms might cause increased energy expenditure. So you will end up using more energy than without those symptoms. And next slide, this slide I'm gonna talk a little bit more, but I also want to expand a little bit more on the gut-brain axis, which is another theory, how that gut and brain are kind of interacting and impact each other. So we talk a lot about gut health, even for neurodegenerative disease. That's because we find this linkage, the bidirectional communication between the gut and the central nervous system through gut microbiota. So that's why sometimes we emphasize on the gut health as well to take care of our brain health. And so some of the topics we covered is about gut health today. But go back to the symptoms and how nutrition can impact, or how the symptoms can impact nutrition. So the symptoms that might impact the energy and nutrition intake are appetite, the one that it would impact appetite, for example, hyposmia, which is the loss of smell, hypoglycemia, and which is reduced the saliva, and depression, delayed gastric emptying, and constipation. All those can delay. Depression might, like Elaine mentioned, might cause reduced appetite, and delayed gastric emptying or constipation, things slow down our guts and they're not going down, so cause us to want to eat less. So all those things might impact our appetite, and when that happens, there's concern of what if we're not getting enough energy or nutrients, and that's when dietitian can help you to make sure you get enough nutrients and energy while those symptoms are going on. It's not that we will cure this symptoms, but we can live with it while still getting a good amount of energy and nutrients that's good for your health. And some other consideration that might impact the energy and nutrients intake are the safety and efficiency of food handling, chewing and swallowing. So this includes dysphagia, which is difficulty with chewing and swallowing, tremor, rigidity, bradykinesia, dyskinesia, and cognitive decline. So all those might impact how you prepare your meals. And with that, sometimes dietitian can come in to help with, modifying the texture of the food so it's safer for you to swallow, or create a recipe that's easy for you to prepare so you can still enjoy it without putting too much effort or energy in the kitchen. And this is an overlap between a few other professionals as well. So the speech language pathologist are, I'm not sure if you've hear a speech from them already, but usually they can help with exercise that might help the muscle around your mouth or the swallowing kind of muscles, and it might help you to chew or swallow more efficiently. And for occupational therapists, they might help you to adapt, find some adapted cooking tool, and help you to navigate around the kitchen more safely. So that's kind of where we can offer like a team-based care and make sure that you can still enjoy the food without too much trouble. And another part is the energy expenditure. Unfortunately, we're not able to help too much with that. Food choices is another thing that dietitian can help. Sometimes with the disease or the side effects of medication, there might be difficulty with control the impulse to or craving for certain food, and that's when we can maybe think about creating an environment that's easy for you to make the healthier choices. And with depression or apathy as well, if there's no interest in certain food, then how we can kind of some food choices that we can make to navigate around that. And there's also other consideration like hydration, food-drug interaction, especially levodopa, which is a common one that will have food-drug interaction with food high in protein, sleep quality, irritable bowel syndrome. So that's kind of a series of gut issues like bloating or constipation or diarrhea that often find kind of in some part, happens in some of the people with Parkinson disease as well. So that's another thing that I usually discover with my client. And also fatigue is something that we can manage with nutrition partially as well. Again, like Elaine said, the symptoms might be different from person to person. So we really need to talk to you to see what impact you specifically and to work around that. And here's a nutrition hierarchy. So I know a lot of people on social media sometimes talk about, oh, like this supplement is super helpful or the superfood can help you. But what we really focus on are what's kind of at the bottom of the nutrition pyramid. So are you getting enough energy or calorie that support you? Do you feel tired, or do you feel not having enough energy when you're exercising? And if you do have and get enough energy intake, then we were talking about like if you're getting enough macronutrients, the protein, the carbohydrate, and the fat that is balanced. So you're getting a good proportion of each food groups. And then if that's also covered, we talk about micronutrients, so the vitamins and minerals. Are you getting enough of those that help with metabolism? And then the meal timing and frequency, especially around medication. If you have a strict medication schedule, how can we timing the meals and snacks so we don't have that drug-food interaction? And also if you're exercising, which is another important part of managing Parkinson's disease, then when you should eat to maximize the effort of the result of exercise. And then if all those are covered, then we can talk about if there's some food that might of specific interest, or if we do need any supplement that for the nutrients we can't met by the food source alone. All right. And then, sorry, just want to check the time. Couldn't see a timer here. Okay.
It's just 20 to 11, Yolanda.
Thank you. I would just speed up a little bit. So how do we meet all those nutrition needs? One thing is following the Canada's food guide. Like I said, there's no specific nutrients or food that we know for sure will help with Parkinson's disease. So following a general healthy food patterns is helpful. And in terms of the types of food among each food groups that's suggested by Canada Food Guide, then we can come into some of the Brain Health Food Guide or healthy eating patterns that can suggest the types of food choices. So Canada's Food Guide, the basic part is a food plate. So as you can see in here, half of the plate is fruit and vegetables, a quarter of plate are protein, and a quarter of plate are whole grains. So trying to aim for that proportion is kind of a first place to go. But again, it doesn't apply to everyone. Some people, if they have a weight loss concern, then they might need a certain part of food, certain food groups compared to others. But if you don't have any specific nutrition concern, and this is definitely a great option to start with. And in terms of specific food choices, here's the Brain Health Food Guide came up with by this group, the Canadian Consortium on Neurodegeneration in Aging. And they have some specific suggestions, such as including variety, focusing on the food patterns, especially focusing on fruit and vegetables, healthy fat, healthy protein choices, and limiting certain food like red and processed meat or food high in added sugar and salt, which come hand in hand with the healthy dietary pattern as well. Some common ones that are mentioned in the literature are the Mediterranean diet, which is the culture-based diet inspired by the dietary pattern of people living around the Mediterranean Sea, or DASH diet, which is the dietary approach to stop hypertension. Both of them have shown protective effect against cognitive decline. And the Mind diet as well, which is kind of a combination of Mediterranean and DASH diet with a focus on the neuroprotective kind of food options. And all these dietary patterns, they share a lot of similar features, such as high intake of fruit and vegetables, olive oil, beans, legumes, nuts and seeds, and whole grains, and lower intake of red meat, processed meat, fast fried food, pastry, and sweets. And we don't know for sure why these dietary patterns work, but some of the things that provided by the dietary patterns definitely play an important role, such as they're high in antioxidant, such as vitamin C, vitamin E, beta-carotene, flavonoids, higher in anti-inflammatory factors. And they also have nutrition adequacy. So as you can see, they didn't eliminate any specific food groups. Some fat diet might ask you to avoid certain food groups, which we don't usually recommend unless there's specific reason, or if you're working with health professionals, and to make sure you're not lacking any nutrients from those diet. But these diet that I just mentioned are fairly inclusive, have all kinds of food group, and provide that nutrition adequacy there. And also those are higher in fiber, which we'll talk a little bit more about. And then omega-3, which is essential fatty acid that our body needs, as well as other unsaturated fatty acid that's good for overall cardiovascular health and the health of our cells as well. I'm just gonna quickly mention about gut health. A lot of buzz about prebiotic, probiotic, and supplements. And really what prebiotic is are the fiber from fruit and vegetables, nuts and seeds, legumes, and whole grain, which are mentioned in those dietary patterns, and resistant starch as well, which is also a natural ingredient from certain food that we can get from those dietary patterns. And probiotics as well, those are the living life microorganisms. You can find them from fermented food and drinks, but not all the food and drinks are that have probiotic have proven effect to impact our gut health. There are some study done on the type of the microorganisms and its impact. And for the more information, you can check a probiotic chart, which summarizes well what it might help, what function they have. And finally, I just want to talk about healthy eating is more than just the food you eat. It's important to enjoy the food. Like Ilya mentioned before, what make you happy, what make you feel the joy is very important, because mental health is another. We don't want to just focusing on the physical health. Mental health is another thing that's also very important to all of us. So just be mindful of your eating habits, but also cook more often, share your meals with others. And if there's some other factors that impact you from cooking with others, or if you're not able to afford certain ingredients, then that's kind of a consideration that we kind of overlap between dietitians and social workers as well. And we can kind of navigate what are some resources that could help you with those. And here are some resources for further interest. And just going to mention some of the research opportunities as well. That's at Brain Wellness Program and Dr. Crosswell's lab that I work at. So this one is about the impact of diet on Parkinson's disease. For more information, you can contact the pd.diet@ubc.ca. And here's another research that kind of just collecting a few information for people with Parkinson, as well as healthy controls, and kind of compare the result over time to understand better what are impacting the disease progression, development, and because we don't know enough about it, so we just want to kind of through this research to understand more. Again, for more information, you can send them an email there or call them. I will share the slide with the host, and you will get those slides as well. And there's some other studies at Brain Wellness website if you're interested in learning more about those. And thank you. That's my part.